Hello and welcome to the Senior Estate Concierge Show. My name is Marian LaSalle and this is my friend Fauska. And Fauska is going to be talking today about home visits and telemedicine, how it helps us and it helps our family and our neighbors and our friends and our coworkers and just about everybody. Hi, Fauska.
Hey, Marianne, thank you so much. I appreciate you having me here. So I am a nurse practitioner and I do house calls.
Oh, I love that. You know, she's here with me right now doing a house call, and that's what you love to do.
Yes.
Instead of going to the doctor's office, you come to us.
Yes. I make it easy for the patients. Other than them going to the clinic, I come to the home, the hotel, or an assisted living, independent living, the office, anywhere, so that you don't have to run around.
And that is wonderful. Not only is she helping us stay out of the doctor's office where there's lots of germs, because everybody there is sick, right?
Right.
But she's also saving us time and gas money and all that. So you're the one that has to pay for the gas. Sorry about that.
Yes. Yeah, so my patient is my priority. So
Mm-hmm.
I'm okay paying the gas, not my patient.
There you go. Another thing that she offers is telemedicine. Would you tell us a little bit about what is included in telemedicine and home visits? Like, what can I expect as a new patient with you?
So as a new patient, you can expect to do everything that you would do on a regular doctor visit. I will evaluate your history, your health, and do your lab work. If I order your blood work, then you go to any lab, or I send my lab people to your home and they do the lab and send me the results, and then I will evaluate the results and get back to you. If you need refills or you need new medicines, or I find something new that needs to be addressed, for example, if your blood pressure is high, then I will order blood pressure medicine and start you on that, depending on how high, or work with you to modify your lifestyle so we can keep you off of the medicine. So
she's talking like right at me, because I did hire her. She is my healthcare provider, and she does exactly what she's talking about. She orders my lab work. She can work with me on telemedicine if we can't get together, or it's not necessary to get together. I just need to tell her I'm feeling this way or that way, or just a casual checkup. She will meet me where I am. Today I happen to be in Houston and she's in Houston, and we're at my hotel room. So you see, it's very flexible. I can't even express to you how wonderful and how supported I feel. So if you have someone that you care for that is in an assisted living, or they just can't get out of the house comfortably, like I'll give you an example. One of the ladies that I know fell and broke her hip. Well, she fell and broke her hip, and when she fell, her glasses hit her head. Her eye was all bulged out. It was just terrible. She was in the hospital for a while, but now they want her to come home. Well, she's not going to want to go to the doctors. You know, that's what they want you to do. They want you to go to the doctors for a checkup. Do you know what it's like to get somebody like that out of bed and put them in a car and drive to the doctor's office and wait for an hour or two? I'm sorry. You know, this is a true story. Otherwise, I wouldn't be telling it. This happens. And this is the exact reason why you need to call. So tell us, how can people get a hold of you?
So you can contact me on 832-519-8093. And if you go to my website at advancedhealthcarepractice.com, all my contact information is there, and you can book a visit right there.
That's wonderful. Let's talk a little bit about the Senior Estate Concierge and how you got involved with that, and why do you like it? Let's talk a little bit about that. So I'm going to introduce it, and basically what I'm going to say is the reason why it's even here. The Senior Estate Concierge was born because Bill Graff, the founder, he decided that if you want to buy a house, he's a realtor, if you want to buy a house and he specializes in seniors, there's so many things that they need that are not available to just anybody, right? How do you know if that senior is moving into an assisted living or they're downsizing, that all these other services are available? So he started calling his friends that knew somebody, and next thing you know, all these people like Faushka who really care about their clients and their patients. He started this Senior Estate Concierge group. So now all the families, the neighbors, the caregivers, everybody is included now in that system because they're all background checked and everybody is accountable for what they do and everybody knows everybody. So when somebody calls the Senior Estate Concierge or they go to that website and they say, do you have a doctor or a home care provider that can come to my house? Guess what? She's a member. And so we know she's been background checked. We know she's really good. She has a great reputation and it just works out. So I'd like to know from you what your experience is with the Senior Estate Concierge.
It is one of my best groups that I have joined professionally. And I must say the benefits are way beyond what I even anticipated.
Oh,
I actually met Bill Graff on one of my other networking groups. And when he told me about how they serve the seniors, I immediately joined. And it's amazing, just by joining, I have served my patients way better because every time I come across a patient that needs something, an example I can give you is my patient that needed hospice, and I was able to call one of our hospice person in the group, and she saw the patient the next day. The family was very happy. I mean, I have reached out to the chef for seniors.
Oh, we just met with her. So there are chefs that will come to the home and they're part of our group and they'll make the food. One of the things I didn't realize they did was they actually go to the grocery store and they buy the food specifically for that patient. So let's say you go into a patient's home and you can see that they're eating terribly. You can recommend the chefs for seniors. Yeah. And then they come into the home and say, okay, well, we're going to make a healthy meal here instead of this, you know, I won't say what kind of foods, you know, are unhealthy because, but everybody's different, right? You, if you want to put them on a low sodium diet or you want to put them on a whatever kind of diet, then that chef can take your orders and cook them the food that they like right there in their home. Yeah. It's amazing.
It is. And I've had some people in the group call me and they're telling me about their patient who is homebound and they're having trouble taking the patient to the clinic. And I have gone and serviced them and, you know, they were happy for the service because, you know, it saved them the trip to the clinic.
That's right. You know, there's just so much. We couldn't possibly fit everything that is great about the Senior Estate Concierge or your service into this short video. So I want you to pick up the phone and call because everybody's different and you might have a different situation that you want to talk about. So you can tell she's just as friendly as can be. She's very knowledgeable. And here's my last thing that I want to make sure that you understand. When I hired her, she came to me, we met, she took my blood pressure, she assessed me, she did everything a normal doctor would do, much deeper level. A one-on-one in my area. I didn't have to go out anywhere. She came to me and you know what she said? Let's work as a team to help get you off your high blood pressure medicine and your cholesterol medicine. Let's work as a team to get you off. Now, my other doctor didn't do that. My other doctor said, oh, you have high blood pressure. Here's a prescription for some high blood pressure medicine. Never once did they say anything to help me It's just, here, take this pill. And so I resisted going to the doctor because I didn't want any more pills. So do you have any last words that you want to express to people that are watching us or listening to our podcast?
Yeah, so I want to let everybody know that there is help out there. Don't feel isolated, or if you're scared of going to the clinic because it's congested, or if you are just too busy to go out there, you're working or you have kids at home and you have no way out, you can just reach out to us. Again, it's 832-519-8093. And we can do a telemedicine where we do a video call, and I will make all the orders and evaluate you, me and you on a Zoom, and give your prescription over. Don't run out of your medicine, because we've had a lot of that happen where people don't go to their follow-ups because they are too busy or the doctor won't set up an appointment. Reach out and we can make sure you have your medicine and follow up with you.
Thank you for being with us today, and thank you for being here and sharing your heart, because it shows. It really, really shows. Thank you.
Thank you so much. I appreciate it.
Now, down below this video, you're going to see all the links that you might need to the Senior Estate Concierge and to this website, this wonderful advanced healthcare practice website. And I really encourage you to at least pick up the phone and call, because you never know. Somebody might need, even if it's not you, somebody that you know might need her. Okay, let's think about our coworkers, our family, our friends. You know, if like my friend who fell and broke her hip, my goodness, she certainly does not want to get in the car every time the doctor wants to see her. So thank you for being here today, and you reach out and we'll talk to you soon.
Thank you.